I'll never forget this day. A 68-year-old patient walked into my office, tears in his eyes, telling me he wished he'd come to see me years earlier. His story? He'd ignored problems with his foreskin for decades out of embarrassment, and by the time he finally got treatment, it was too late. He developed a serious infection after surgery, lost sensation completely, and hasn't had intimacy since. He looked at me and said, "Dr. McLeod, if I'd just talked to someone sooner, my life would be completely different today." That conversation haunts me, and it's exactly why I'm making this video. After more than 30 years in practice here in Canada, I've seen this scenario play out far too many times. So today, we're going to have an honest, straightforward conversation about something most guys don't want to talk about: foreskin. With or without? It's a question that sparked debate for centuries, rooted in culture, religion, and medicine. But here's the thing, in today's world, where we've got more scientific information than ever before, this debate is less about tradition and more about health, function, and personal choice. Now, I'm not here to tell you what's right or wrong. There isn't one answer that fits everyone. What I am going to do is give you clear, evidence-based facts so you can understand what's best for your situation. We'll cut through the noise and look at the natural function of the foreskin, the proven benefits of removal, the potential risks involved, and the specific medical reasons why surgery might not just be an option, but a necessity. By the end, you'll have a much clearer picture to help you make informed decisions. And honestly, that's all any of us can ask for. Let's start with the basics. What exactly is the foreskin, and what does it do? The foreskin, medically known as the prepuce, is the retractable skin that naturally covers the head of the penis, which we call the glans. At birth, it's actually fused to the glans and gradually becomes retractable over time, usually by puberty. But it's not just a simple piece of skin. It serves several biological functions that are worth understanding. First off, there's protection. The foreskin acts as a natural covering, protecting the highly sensitive glands from constant friction against clothing and from contact with bacteria or irritants in the environment. Think of it as a built-in protective barrier for one of your body's most sensitive areas. Makes sense, right? Second, there's moisture and lubrication. The inside of the foreskin helps maintain a moist, chemically balanced environment around the glands. This natural moisture can contribute to comfort during sexual activity. It's designed that way for a reason. And finally, there's the question of sensation. The foreskin is incredibly nerve-rich tissue. It contains thousands of fine-touch nerve endings that are highly sensitive to stimulation, and for many men, plays a significant role in sexual pleasure and arousal. That's not something to dismiss lightly. For thousands of years, foreskin removal, also known as circumcision, has been practiced for cultural and religious reasons. Today, though, many people make this decision based purely on medical and health considerations. So let's look at the other side of the coin. What are the scientifically proven benefits of foreskin removal? First up is hygiene. A circumcised penis has exposed glands that are generally easier to keep clean. This prevents the buildup of smegma, a thick, whitish substance made up of dead skin cells and oily secretions. Now, smegma is harmless and washes off easily with regular cleaning. But if hygiene is neglected, it can accumulate, leading to unpleasant odor and a buildup of bacteria that can promote inflammation and infection. I've heard from many older patients who find that as they age and mobility becomes an issue, keeping that area clean becomes more challenging. One of my patients in his 70s told me straight up, "Doc, I got circumcised at 72 because bending down in the shower was getting too difficult, and I was worried about infections." That's a real concern for many older gents. This brings us to the second major benefit: reduced risk of certain infections. Moisture and bacteria can accumulate under the foreskin, increasing the risk of melanocystitis, which is inflammation of the glands and foreskin. Studies have also shown that infant circumcision can significantly reduce the risk of urinary tract infections, especially in the first year of life. While that might not be relevant to you now, it's worth knowing if you're advising younger family members. The third benefit, and perhaps the most scientifically documented one, is the reduced risk of contracting certain sexually transmitted infections, or STIs. This is where the evidence gets really compelling, folks. In parts of Africa where STI rates are high, several large-scale randomized controlled trials were conducted. including groundbreaking studies published in prestigious medical journals like The Lancet. The results were consistent and clear. Male circumcision was found to reduce the risk of HIV infection during heterosexual intercourse by up to 60%. That's a significant reduction. But the research didn't stop there. These studies also showed a significant reduction in the transmission of HPV human papillomavirus, which can cause genital warts and is one of the leading causes of cervical cancer in women, as well as penile and throat cancer in men. Additionally, there was a documented decrease in the risk of contracting herpes simplex virus type 2, the virus that causes genital herpes. The protective effect is believed to be due to the nature of the inner foreskin, which is thin, non-keratinized, and contains many immune cells that HIV and other viruses target as entry points into the body. By removing this vulnerable tissue, you're removing a primary gateway for infections. However, and this is a crucial point to understand, circumcision reduces risk. It doesn't eliminate it. It's neither a vaccine nor a substitute for safe sex. Using condoms remains the most effective method for preventing STI transmission. Let me be crystal clear about that. Finally, there's reduced risk of penile cancer. While penile cancer is very rare in industrialized countries, the risk factors are closely linked to chronic inflammation, poor hygiene, and HPV infection. Since circumcision improves hygiene and reduces HPV rates, it's directly associated with a lower lifetime risk of developing this type of cancer. Now, like any medical decision, this isn't a one-sided story. No surgical procedure is without drawbacks. What are the risks and disadvantages associated with circumcision? The most obvious is that it's a surgical procedure, and like any surgery, it carries a range of risks, even though these are generally very low when performed by a qualified professional in a sterile environment. These risks include pain during and after the procedure, particularly in the immediate healing phase. There's also the possibility of bleeding and infection at the incision site. In some cases, the cosmetic outcome may be unsatisfactory, such as scarring or removal of too much or too little skin, which might require a corrective procedure later on. The most commonly cited drawback is the possibility of altered sensation. As I mentioned, the foreskin is full of nerve endings that contribute to sexual pleasure. Removing this tissue, by definition, changes the sensory experience of the penis. The now permanently exposed glands undergoes a process called keratinization, where the skin becomes somewhat thicker and less sensitive over time. While many circumcised men report fulfilling and satisfying sex lives without any perceived negative effects, some do report a change or reduction in sensitivity that they feel affects their sexual experience. This is a highly subjective topic, but it's a legitimate consideration. I've had patients on both sides of this. Some who say it made no difference, others who noticed changes. That's why it's so personal. Finally, removing the foreskin means losing its natural protective and gliding function. The glans is permanently exposed to friction from clothing, which leads to the keratinization process we just discussed. And while we're on this sensitive topic of sexual health and performance, it's important to acknowledge that many men's concerns go far beyond just the foreskin. They relate to the central challenge of achieving and maintaining a strong, reliable erection. If that's something you've thought about, you're not alone. I recently came across a fascinating video by a leading biomedical engineer who describes a remarkably simple 7-second home remedy that addresses the real scientific cause of male performance issues naturally, without pills or risky injections. For those of you interested, I've made it easy to check out. Just point your phone's camera at the QR code you see on the screen, or I've also dropped the direct link in the pinned comment right below this video. It's genuinely eye-opening. All right, let's get back to our main question and talk about the specific medical situations where circumcision isn't a choice, but a clear necessity. So how do you actually decide, after weighing all the pros and cons? When is surgery the right choice? The answer is straightforward. It depends entirely on your individual situation. There are certain scenarios where circumcision isn't just a choice, but a clear medical recommendation. The most common is a condition called phimosis. This is when the foreskin is too tight to retract over the glands. In mild cases, it can be manageable, but in severe cases, true phimosis can make proper hygiene impossible, lead to recurring infections, and cause significant pain during erections or intercourse. I've had patients tell me it felt like their penis was in a vice grip. That's not something you should just live with. Now, here's something important that I've learned over 3 decades of practice. Not every case of phimosis requires immediate surgery. Many guys don't know this, but there are alternatives. Topical steroid creams prescribed by your doctor can help loosen tight foreskin over time. There are also gentle stretching exercises that, done properly and consistently, can gradually increase elasticity. I've seen these work for plenty of my patients, especially those who caught the problem early. Another option is something called a dorsal slit, which is a partial procedure that relieves the tightness without complete removal of the foreskin. It's not as well known, but it's a middle ground that some men prefer. The key is talking to a urologist who can assess your specific situation and discuss all your options. Don't let anyone rush you into surgery if there are conservative treatments that might work first. A related but more urgent condition is paraphimosis. This is a medical emergency where a tight foreskin gets retracted behind the glands and then can't be brought back to its normal position. It acts like a tourniquet, cutting off blood supply to the glands and requiring immediate medical attention to prevent serious tissue damage. If this ever happens, get to the ER right away. Don't wait. Additionally, for men suffering from chronic recurring infections like melanocystitis that don't respond to creams or improved hygiene, circumcision often provides the definitive solution. I had a patient in his 60s who'd battled recurring infections for years, tried every cream and treatment, and finally said, "Enough, let's just get it done." He wished he'd done it a decade earlier. For everyone else, the decision tends to come down to personal factors. For parents of a newborn, the choice is often influenced by cultural, religious, or preventive health beliefs. For an adult without health issues, the decision is usually based on personal preference, weighing the potential health benefits against the risks and desired cosmetic outcome. Let me share another story that really drives this home. I had a patient, let's call him Jim, who was in his early 70s. He'd been having issues with his foreskin for years, but was too embarrassed to talk to anyone about it. Not even his wife knew the extent of the problem. He finally came to see me when the pain became unbearable and he was getting frequent infections. We did the procedure, but unfortunately Jim had waited so long that complications had already set in. The tissue was inflamed and damaged, which made healing more difficult. He developed an infection post-surgery, and while we managed it, he told me later that he'd lost a lot of sensation and his intimate life with his wife had essentially ended. He said to me, "Hannah," he always called me by my first name, good Canadian guy, "if I just swallowed my pride and come to you 5-10 years ago, I'd still be enjoying my retirement properly." That conversation broke my heart, and it's why I'm so passionate about getting this information out there. Guys, there's nothing to be embarrassed about. Your body is your body, and taking care of it is nothing to feel ashamed of. I've been doing this for over 30 years. Trust me, I've seen it all, and there's nothing you could tell me that would shock me or make me judge you. So let me answer some of the questions I hear most often in my practice, because I know these are on your minds. Doc, is hygiene really that difficult? Look, for most guys who have good mobility and take regular showers, keeping an uncircumcised penis clean is straightforward. Just retract the foreskin, rinse with warm water and mild soap, and you're done. It takes 30 seconds. The problem comes as we age. If you've got arthritis, mobility issues, or you're in a care facility where you're not bathing as frequently or independently, it can become challenging. That's when infections become more common. I've had plenty of patients choose circumcision in their 70s or 80s specifically because of this. What about sex? This is the big question, isn't it? The honest answer is it varies from person to person. Some circumcised men report no change in pleasure or function. Others notice differences. The foreskin does contain nerve endings, so removing it changes sensation. That's just biology. But many factors affect sexual satisfaction, and the foreskin is just one piece of the puzzle. I've had patients on both sides tell me they're perfectly satisfied with their sex lives. The key is realistic expectations and open communication with your partner. Can I just leave it alone if there's no problem? Absolutely. If you're not having issues, no pain, no infections, no difficulty retracting, then there's no medical reason to do anything. Many men go their entire lives with an intact foreskin and have zero problems. The natural state works just fine for plenty of people. The decision to circumcise should be based on actual medical need or strong personal preference, not just because everyone else is doing it. In summary, folks, here's what I want you to take away from this conversation. The foreskin serves important functions, but removing it has scientifically documented health benefits, particularly regarding reduction of infection risk. At the same time, it's a surgical procedure with risks and permanently changes your body. There's no simple, universal answer to this decision. Rather, it's a complex choice that should be made carefully, considering both sides. If you're experiencing pain, discomfort, difficulty retracting the foreskin, or you have other concerns, the most important step you can take is to have a conversation with a doctor. A urologist can perform a physical examination, assess your individual anatomy, and give you a tailored recommendation based on your health and your body. This decision should absolutely be made in consultation with a physician, not based on information from online forums or individual anecdotes, though I hope this video has given you a solid foundation of knowledge to start that conversation. And let me say this, if you're sitting there thinking, I probably should get this checked out, but I'm embarrassed, please don't be. We're all adults here, and your health matters more than any temporary discomfort about discussing it. I've had countless patients tell me they wished they'd come in years earlier. Don't be that guy. If something doesn't feel right, get it looked at. That's what we're here for. One last thing I want to emphasize, especially for you older gentlemen watching this, it's never too late to address these issues, but earlier is always better than later. The body heals more quickly when you're younger and healthier. Waiting until a problem becomes severe makes treatment more complicated and recovery harder. If you're noticing changes, increased difficulty with hygiene, recurring irritation, or infections, don't brush it off as just part of getting older. Get it checked out. Your quality of life matters at every age. I hope this balanced overview has helped clarify this topic for you. If you found this video helpful, please give it a thumbs up. Subscribe to the channel for more evidence-based health content and share it with others who might have the same important questions. And hey, if you've got questions or topics you'd like me to cover in future videos, drop them in the comments below. I read them all, and your input helps me know what you're concerned about. Thanks for watching, everyone. Take care of yourselves, and remember, there's no shame in asking for help. That's what we're here for.